That's great. Thank you. Yes, this is an easy segue for me. And I'm so, excited to be part of this panel today. I've known some of these individuals for a very short time and others for a very long time, and they're doing amazing, great work that I'm excited for them to share with you today. So I am joined by Dr. Juliana Cohen from the Merrimack College School of Nursing and Health Sciences, and she has a secondary appointment at the Harvard School of Public Health. Dr. Jessica Stroope from Louisiana State University School of Nutrition and Food Sciences, and one of our amazing Catalyzing Communities partners and a dynamic individual, Dr. Yvonne Greer, who is affiliated with Mount Mary University. So I don't want to steal their thunder. I think I've done enough talking for right now. So I've asked them to prepare a brief 1 to 2 minute introduction to highlight their background and the way that they feel they would like to highlight it and any work related to this topic. So I think we'll just take turns. And since we have pictures in order, I guess I'll go in that order. So over to you, Dr. Cohen.
Everyone, first of all, thank you so much for the opportunity to be here today. I really appreciate all the planning that you, Erin, has done, as well as the rest of the NCORE team. So just want to say thank you so much. So a little bit about my background. My interest is really around the policy side related to child nutrition policies. So I do a lot with working with schools across the United States, as well as increasingly internationally, around developing interventions and policies that are sustainable, equitable, and resilient, that really focus on improving greater access to healthier, culturally appropriate school meals, opportunities for physical activity, and then being very deliberate and thoughtful about the approach in terms of the outcomes that we measure. So not only thinking about those related to improvements in nutrition and physical activity, but working very closely with the community and policymakers to understand what are their greatest values, to think about ensuring that we're measuring that, which really can help with the sustainability and resilience of these type of interventions.
Thank you. Dr. Stroope?
Hi, so I work for the LSU Ag Center. I'm with Cooperative Extension, and I'm funded by the SNAP-Ed program and then also by the CDC High Obesity program. And so my role is the physical activity specialist, which is primarily focused on walkability. So we do robust community engagement, mostly in more rural areas, outside of urbanized areas with rural communities, working with, schools, council on aging, churches, low-income housing to learn, like, where do they want to walk, and how can you get from the park to the school to housing. And then I work a lot with our State Department of Transportation to make that more possible, like the funding systems. How is the application process possible? How can we get the match reduced? And so we've been able to secure over 13 million in sidewalk funding for communities under 5,000, but then it takes a long time to get built. So we've made some changes at the state level with policy, and now it takes years for those projects to be built. So we won't see, there'll be another effort in this, what was said earlier about the importance of continuing practice with funding. So we'll have the SNAP-Ed people try to work community change of norms around walking to school, walking to the park, but that can't happen until those projects are actually built out. So this will be like a total of like a 7 or 8 year process from, when the engagement starts to when we can engage around working on walking to school and walking to the park. That's me.
That's great. Thank you. Okay, Dr. Greer.
Hello, everyone. I am a doctor of public health, but also a registered dietitian and a certified dietitian with the state of Wisconsin. I have a private practice business called Why Eat Right, Nutritional Consultant for Healthy Living. And I always start off with the statement that when I started my career as a registered dietitian, my ultimate goal was to reach as many people as possible to help them to live long, healthy, and productive lives. And that's why Eat Right was formed, but it was formed as a part-time job because I worked 22 years for the City of Milwaukee Health Department. And I also, of course, mentioned that I am an adjunct professor at Mount Mary University and also in their integrated science nutrition program. And then also I am a field experience preceptor at the Milwaukee Area Technical College for their dietetic technician program. One of the bigger highlights is that I lead the Milwaukee County Organizations Promoting Prevention, which is called MCOP, a coalition that's been in existence for over 19 years, doing various different initiatives and grants with our goal of promoting the health of Milwaukee children, family, and residents. So everybody in the city of Milwaukee, Milwaukee County, in 2010 to 2014, we did receive a Robert Wood Johnson's Healthy Kids, Healthy Communities grants, and that we were able to, over a 4-year period, work with 8 different neighborhood centers to develop land use policies, healthy food and beverage policies, active living policies, and then also staff education and development around health and wellness policies that were adopted by all 8 ONCOM agencies. I'm also as leader of MCOP, and also through my business, have about 4 different grants that I'm working out of right now. Of course, we mentioned the catalyzing communities. We had a healthy and fit kids initiative, but with Tufts University, but also Nurturing Collaborative, which is working with Birth Workers United and also Feeding America to develop and provide food boxes to pregnant women. We're also recently working with the state of Wisconsin, have 2 CDC grants that are looking at promoting health and wellness and heart health and wellness, called the Heart Health Learning Collaborative, using that learning collaborative model with multi-sector individuals to really look at how do we create systems change from both the community side, which I'm director of community engagement, lifting up the voice of the community so that it can inform the system changes that take place. And then also, it's a new action grant that really looks at social determinants of health and how we can, again, create solutions that promote restorative justice using the voice of the community. So all of that community engagement pieces are going on simultaneously, and I'll talk more about some of those as we go forward.
Great, thank you so much. Well, I think it's clear to everybody who's a part of this workshop why you 3 are at the table. So thank you so much for your time and for being willing to share your wisdom and expertise with the group. We've used that word community engagement a couple of times now, and would love to hear more about, your approach to engaging communities for PSE change, especially from the lens of what has been most successful to you over time, or even what has been most challenging. So maybe I see you first, Dr. Stroope. So I'll start with you.
Sure. So, we started out doing like community forums, and we still do community forums, but those require people to go somewhere, and they tend to have a certain kind of slice of the community. So we do a lot more showing up where people already are, going to the high school football game homecoming event, going to the school field day, going to where people already gathered, trying to get good food and music. That helps a lot to get people to show up. So we've worked with like our Medicaid vendors to get food, and just make it really fun. Like we use pop-up play, like play streets events that kind of draw people in and get the kids engaged in input. Make sure that, we have the voices. We work a lot with teens. So I lead a lot of walk audits, and I try to be strategic with getting the elected official to walk next to the high school basketball player and to hear from the kids. Yes, we walk here. Yes, we bike here. This is where we feel dangerous. Because sometimes the adults, their worlds are so separate and they don't see that kids where they're active, their time, if they go to work early and they come home late, they just may not see the pedestrian traffic, and they may not believe that people are actually, that they need to walk places. So just trying to make those connections between people. You kind of give them a platform like, okay, I'm going to make it really easy for you to connect Yeah, we work a lot with libraries. Libraries are just such a vibrant place to connect with everyone in a community. Yeah.
That's great. So really leveraging those sort of network connections and spaces and places where people come together.
Yeah,
build
the existing people, Council on Aging, that's our kind of older adult services. Those are incredible partners, and it's easy to go to them. Like it doesn't, I know that they will have so much input on vulnerable populations if I just show up there.
Great, great. And Dr. Cohen.
So I think a big part of this, as kind of, I think a big theme of today is really from hearing from so many different voices from within that community and thinking about who is commonly represented when I work with different communities, but also the voices of those who are less commonly. And so just one small example would be whenever we provide opportunities to engage parents, for as one example, we're translating it into 5 or more languages that are commonly spoken within that community. So really making an investment in trying to access as many voices as possible, but also thinking about who are going to be both the policy makers, the decision makers at the end of the day, particularly in a school setting. So that's oftentimes going to be your teachers, your principals, the superintendent, and also thinking about, as we talked about earlier in today's session, those implementers. So really understanding kind of the diverse impact that these different types of policies may have on those who are actually implementing it. So again, in the school setting, oftentimes it's the teachers, and recognizing the importance of really mixed methods. So thinking about truly getting and understanding the voices of the impact of these type of interventions and policies and how those may vary across diverse settings, even within a school. As one very quick example, I work very closely with Anchorage School District in Alaska. And when we are looking at the impact of a wellness initiative to provide more time for lunch as well as longer recess, we went into different schools to understand like what was the impact that this had on teachers. And what we found was that it varied considerably based on the buy-in from the principal and how this was actually implemented, where sometimes the teachers had a true voice in saying, this is how we want to implement it. And in other situations, the principal said, this is how you're going to do it. And the impact that had on how the interventions was actually being implemented, the feelings of support versus burnout were completely different in schools that were even just a mile apart. So really being able to work in these diverse settings and understand how these interventions, these PSE strategies are truly being implemented.
Great. Dr. Greer, would you like to add your thoughts?
Yes. One of the things that we work on is relationship building through transparency and collaboration, meaning that we are looking at sharing our vision, our mission, our values before we even invite people to the table. We wanted to say, what could we do really well? And we decided that we can be a connector, that we can be a convener and convening and bringing people together, looking at collective action and also support. What we're really are doing is not only bringing together multi-system researchers, but we're looking at our community as our community experts. And so we're honoring their lived experience. We're making sure each person's contribution and each person's effort, whether big or small, is really recognized. One of the exercises that is part of that community-based systems dynamic piece that we were taught was to really look at the hopes and fears that people have in being part of this, bringing community in and really ask them, how do you feel about this? What are your hopes and fears? And being able to be stewards of their troops, meaning that we not only write them down, but we go through the process of addressing them and going in the course of what we're doing, so that in a year or so we can go back and report on these things were addressed, these things were put into the mix, and that we recognize and honor your words. the last thing I would say is that we do then, by having the relationship, putting it out there, we have an open invitation to all different cultural groups, all different entities to join with us, to share in the power of what we're talking about, from decision making to prioritization of actions to promotion and outreach, and then implementation, but also dissemination and recognition. Because one of the things that we want to make sure is that we honor everyone for what they bring to the table. If we're going to honor the researchers, we're going to honor the individuals and the community members as co-researchers as well. So that's how we approach it.
That's great. I love the intentionality. And I guess, thinking about the topic that we're, discussing today around obesity related policy system and environmental change, what have you witnessed in terms of either how you work with communities or the conversations that communities are having, or have you not seen any shift? Has it been the exact same? You all have had a long history of working in this space for some time. So I would love you to share and reflect on that. And then also, I'd like to from there then think about, where do we think we're going next? Like, what do we need to really kind of think about what the next 10 to 15 years look like? So let's start with, any shifts or noticeable changes that you've seen that have influenced your thinking in the work that you're doing with communities. And I'm not going to call it. So if there's anyone who would like to step forward first.
I'll share one quick thought on that. So one thing I've learned in the last 10 years is not all of my local practitioners have the same amount of cultural competency. That's okay, but sometimes things need to be made explicit. Like about 5 or 6 years ago, we were doing a community youth event, and I didn't give instruction on music. And I had some teens in charge of the playlist. It was all appropriate music, but as soon as they put on the music, half of the kids, almost all the Black kids left, because the music communicated who belonged in that space. And so it's like some of the small details, where you hosted an event, what kind of food you serve, what kind of music is played, are kind of codes for like who belongs here. And so some of those details, you don't necessarily think, oh, the music choice is really important for how the community engagement is going to go, but it can be. And that requires like local insight, local knowledge that, me in Baton Rouge is not necessarily going to have. One small thing.
And going off of what Jessica said, I think one of the greatest shifts that I've seen that I think is particularly exciting as a researcher is within the research community going in much more humble and recognizing that the community is actually the experts and we're more to play a support role. And I think, Erin, you have done such a beautiful job of that with Chris Economos and your collaborations through the research that you've been doing with Childhood 180, and really that kind of balance of recognizing our own expertise in terms of perhaps some of the design and data collection, et cetera, but really a much greater emphasis on who the true experts are, which are those community members.
And I totally agree with you on that, because like I said, we call our community members community experts. And one thing that I see is the voice of the community is being taken a little bit more seriously and lifted up in the work that is being done. One thing has been shown, that as much research as we've done, as much documentation as we've done over the last 30 or so years, things have not changed. And so looking at some different approaches, even in the 2 grants that I'm doing, we have a big emphasis on community conversations and community health action teams. And when we invited the community in to be part of our planning group, because we did get a CDC grant to do a whole year of planning, they said no one included them in that way, when they were included from the very ground up, that they were really, lifted up to say your lived experience really makes a difference. And by doing that, we found out things like there's transportation services set up, but they don't work. Even though they're there, they're not working efficiently, and it's not helping people to get to and from the doctor, and they dread even calling them, because sometimes they show up, sometimes it might take 4 or 5 hours. Now, I shouldn't say that long, but at least 2 or 3 hours for them to come back and pick them up. So then they'd have to go and find somebody else. So the actual reality of what is the real reality of what's going on, we wouldn't have known that had we not asked the community. But another thing was, they took in some of the planning, and when we thought, okay, we'll just set up things in the evening and have them, participate that way, some of them felt so empowered that they said, I'm taking a vacation day off when we do the conference because I want to be there. I want to share. But we did some stuff to make sure they felt empowered, that they felt that their voice counted, that they dispelled the idea that nobody cares about what they're going to say anyway. So those are the type of things that we really need in order for us to really do true systems change and have it something that the community sees as positive social change and not just making a change.
Right, right. That's great. I wholeheartedly agree with that. And I think, that's one of the things that we often kind of discount and is really important when we think about PSE change, is that for people to continue to buy into this work and drive this work, you want to be part of something that you see change in, that is actually happening, and there's tangible results and information coming back. And sometimes that can be really hard, especially when we're thinking about moving needles, like as you were saying, Dr. Stroope, where I need 7 to 8 years. Like I have money now, but then it takes time to build the infrastructure, and like the way in which you can continue to make sure the community is part of the whole process, not just at the end or at the beginning, but throughout, so that they understand, that work is happening, and sort of excitement and enthusiasm don't begin to wane on that.
Can I add one more thing in?
Of course you can.
I will say that the community-based system dynamics work that we were able to do when we actually mapped out our system and really saw the influences of all different things on children eating healthy meals was kind of like our concept. By doing that work, the community, and really digging into it, taking the time out to do that, our community, we did it in 20 to 21. Here it is, 2024 going into 25, and people are so energized still. So taking the time to do that work really makes a difference. And I think it's very positive to see. And so now, this idea that the community is the ones driving some of the work that's being done is a little different than what it used to be.
One more quick thing that I'd love to add as well, and Erin, I think you did a really beautiful job of touching on this in your presentation earlier, is that I think another really important shift that we've seen is this very intentional focus on health equity. And I know we'll be hearing from Shariki Kumanika later, but I just think her Getting to Equity framework has just been so powerful at moving our field in a stronger direction, and just being so deliberate in each stage of these PSE interventions, changes, and to be that kind of deliberateness around who is being impacted, how are they being impacted, and thinking about that from every stage, from that community engagement part, as well as thinking about how the data is being collected, how it's being analyzed, and also importantly, how it's being disseminated back to the community as well. So I just think it's so important. That's such a core element of the PSE work that I do, I think we've seen such a great shift in this equity focus as well.
Thank you. And this came in from a question, and as you were talking, I was sort of thinking about this, because I think sometimes when we talk about this work, it seems really quote unquote easy, and that we don't make mistakes and we're not human, and it's really hard, and I know myself as a researcher have made numerous mistakes, working with communities over time. That's how I've learned and gotten better. And I was just wondering if you could kind of speak to that, whether you either have personal experience or have seen that happen, and in ways, when there has been an issue that's come up, either with a research or academic community partnership or research, or just even in your own multi-sectoral groups that you're working with, when there is a mistake or a misstep, what do you do to sort of acknowledge that? Do you acknowledge that? Do you acknowledge that publicly? And any, reflections or thoughts on that could help others who might have been in a similar space or might want to be in a similar space?
So one thing I've learned is the importance of asking, what are we missing? So I think of one town in particular, we developed this lovely looking complete streets plan, and it was based on a lot of community input, but of course we don't have everyone. And so, it was formally adopted, great start, but as we had conversations in the subsequent years, I realized there's a whole quadrant of town that really wasn't represented at all. That was pretty vulnerable. We really thought we'd done a good job. So then going back and be like, all right, okay, how now we try to always ask, okay, who are we missing? What, here's our plan. What do we have wrong? And doing kind of another layer. Like we started with just initial community input, and now we have a formalized second round of, after we've made our plan, to really try to get, okay, it seems like it's easier for them to give input on on a map, on something that already has routes on it. It's then to just like a big map. It's like it's easier for them to be like, oh, you've missed this whole area. So, I mean, do we formally acknowledge? I mean, yes. Maybe if I'm submitting it with a grant application where that map that's based off of that, I might not mention it. But going forward with the community, yes. Yeah.
I'll just quickly share that one thing that I've learned over time is that different communities can have different politics, literally and figuratively. And to really understand what those politics are, including sometimes distrust of subpopulations within a community, for example. And I think oftentimes one trying to preemptively get at that, but also recognizing if you're not truly part of that community, there's going to be many opportunities to miss that and to make mistakes. And I think there's never been a situation where I've had to make a public announcement or anything like that. But really the question that always gets said is, well, how can we make this right? And working with those different community members to say, I want to make sure that your voice is heard. I hear it. I understand what you're saying. How can we make this right? And working with those that need to be worked with to address any challenges. And so again, this is the reality of working with those communities.
Following up with that, we've learned kind of the hard way the importance of understanding the political cycle. So in rural communities, if the mayoral election is in October, I really shouldn't be doing a bunch of engagement in September. Like it's really critical to understand what the cycle is and to try to let the local politics ride out before starting a new project. So we've learned that the hard way, doing public announcements about things with the current elected. I mean, you have to have the elected officials to do this kind of work. That's, infrastructure, but timing matters.
Yeah. And one of the things that I will add is that sometimes the grants are written before they actually come and talk to the community. So the idea of really getting an idea of, we're thinking of doing this type of a grant or applying for this, meeting with the community, getting their input, getting their ideas of what really is the need. Sometimes it's done the other way. We write the grant, we get the grant, and then we come to the community, and sometimes the whole idea of it is something that I could have told, the community, or say I could have told them that's not going to work. And so that relationship piece needs to be developed in the very beginning of when you start thinking about doing this type of work versus coming in after the fact. There was one research project, and I'm not going to say who, and it was a big health systems that did it, who developed a healthy kids weight loss program. And they called me in and they were setting it up, and we're going to have, youth come to all of the different community centers and all sorts of things. And I got there and they did not mention how the parents was going to be involved. And one of the researchers said, we're not worried about the parents. And I said, well, how do you think it's going to work without including the parents? You just can't work with the youth and not work with the parents. And so it was really, they almost the idea that they had this mindset that the parents doesn't really care or they're just not. So those are the types of things that it's like, okay, you're going to miss the point, because even some of the students, when we were working with them, they said, you're giving us all this information, you need to give it to our parents. And it's like, oh, because so those are the types of things that we're saying, is that when you're doing programming and you're really looking at, I say, promoting healthy weights in children and through an asset-based standpoint, looking at what we would want to see, we really need to look at the home environment and the parents and the social structure that the children are in, not just trying to develop something for youth.
Right.
Otherwise, you're going to miss the point.
Mm-hmm. Yeah, and I think, from the research perspective, I think it's really important to ensure, that, community engagement isn't about a means to an end. It's being intentional, and it's about, as you were saying, Dr. Greer, listening and understanding the community and what they need and want, and what they view as important and powerful and feel like they would work, and making sure that's, you're not just listening to that, but it's being incorporated into that. And I do want to acknowledge, for folks who have a chance after this, I recommend, we have on our Catalyzing Communities webpage a learning collaborative, and we've had several keynote speakers, and Dr. Tashar Ali gave one recently and really kind of spoke to this, that from a research side, you need to show up and you need to be in the community and with the community and work to understand their needs, versus I'm coming and there's a funding opportunity, or I have these ideas and like, can't they help you community, right? It can be the other way, and it can work better that way. And perhaps that is a shift that's happening, hopefully, maybe slowly, and could really help advance the work in this space. So I guess with that, I'd love to know a little bit more about what you see as the next frontier of your work, and what would really help advance the field of obesity-related policy systems and environmental change from the perspective that you have. So how about, I haven't started with you in a while, Dr. Cohen, so I'll kick it off with you.
I think this is a fantastic question, and something that I try and give a lot of thought to in terms of kind of where's the field going. And I think we've already really been laying a great foundation in terms of that equity focus, that true community engaged focus. And I think really spending more time thinking about that sustainability and resilience side of it. So thinking about really taking a more deliberate approach to around measuring those outcomes that I think are going to be key and most important to that community. And one thing that I use the word humble a lot at today's talk, that I think was really humbling for me, is a lot of the work that we're doing when we're evaluating what's the impact this has. My background is as a nutritionist, and oftentimes that's actually not the number one priority of the community. And so this can vary greatly, whether it's policymakers at the state or the federal level. This can vary whether it's with those within a school district, and really understanding what are those areas that are most important. And as kind of one quick example, working in several school districts, some of the most important things to them are what's the impact as we're recovering from COVID on social and emotional learning. So how can the type of interventions we're doing support that as a primary aim? We're still looking at the impact on looking at the measures like plate waste, how much are kids eating, the impact on their diet quality, things like that. We're doing an initiative in Ukraine right now, for example, which is a priority of the First Lady. And the key priority is the impact on mental health, as they're experiencing and recovering from war, and really understanding what are the key priorities of that community that may differ from ours as researchers, and to be very thoughtful, deliberate at every stage of these type of PSE interventions to truly understand what are those priorities of the community. And it's not to say we don't have to, we can still measure those outcomes that I think are really important for those public health outcomes, and to be very deliberate about understanding and measuring those key priorities of the community itself.
Dr. Greer, would you like to share any thoughts about what you see as needing to advance or make progress in this space?
I was smiling when she brought up social and emotional health, because I have that written right here on my sheet of paper, must be addressed before self-efficacy can actually be materialized. One of the things that has been coming up as we've been dealing with our community health action teams is the amount of mental health and also emotional health issues that are out there that's impacting women, men, youth, across the board. And the idea of our social connectedness and our social well-being is all part of that. And it influences your, food intake. And children, when it comes to relational health, how well they can deal with others, how well they can deal as they grow, is really impacted by the parental trauma and stress that is in the family. And so those types of things we've been looking at on when we start saying promoting healthy weights in children, not just focusing on how to get people to increase exercise or the children to increase exercise, but how do you promote a healthy environment from the parents to also all the children in the family, so that everyone has the potential to be healthy, well, and adjusted. And I think that social and emotional health and social connectedness, social capital, those types of things are starting to get looked at, because I know one of the bigger things is the social needs assessment. And we even had different health systems that do social needs assessments, and they found some who actually take the time to know who are you going to refer people to if they need help. And some of the community says they get a social needs assessment and the person never looks up off the piece of paper. Mm-hmm. So they're saying that's not going to work. And so that it still goes back to relationships, but it really still looks at how are we going to be addressing, because now that we know that social determinants of health is, primary to actually creating healthy lifestyles, how are we actually going to do that in a way that is effective to the individuals?
Thank you. And we're almost out of time. So Dr. Stroope, I'd love to have you have the last word on this.
Thanks. So one thing I'm thinking about is, so once we get these sidewalks in place, we want to, work with communities to change norms. How do we measure that? I want to work with each community to, what are the strategies? Is it going to be a walking school bus? Is it going to be let the walkers out first? Is it going to, walk to school days? But because it'll probably vary a little bit in structure from community to community, how do you evaluate that meaningfully? I think there's opportunities for natural experiments across the country with all the increase in infrastructure dollars for walking and biking, in the recent bipartisan infrastructure law. But that's a different skill set than what I have. But I think there's a lot of opportunity moving forward to look at, how do we combine the changing the norms after we have new infrastructure in place, and where does that work well, and what can we learn from it?
Yeah, that's great. So, from what I'm hearing, right, there have been some true shifts in society, not just in our science, but just the things that are happening in the world that are affecting how we can and cannot approach this topic around obesity related policy systems and environments. And we got to make sure that if our basic needs aren't met, if our social needs aren't met, if our mental health needs aren't met, then we're not really going to make the progress that we need. So appreciate your attention to all of that. So this has been I've learned so much from you. I'm so honored to be in this space with you, and thank you and appreciate all of your time that you shared on this panel today. So have a wonderful afternoon, and I will hand it back over.